Understanding diabetes from other causes. If you suffer from diabetics and want to live a normal life, click the link in the description for your free guide. In addition to type 1, type 2 and gestational diabetes, a small minority of people develop specific types of diabetes due to other causes. This includes monogenic diabetes syndromes, such as neonatal diabetes and maturity-onset diabetes of the young, MODY. Diseases of the exocrine pancreas, such as cystic fibrosis and pancreatitis. Drug or chemical-induced diabetes, such as with glucocorticoid use, in the treatment of HIV, AIDS or after organ transplantation. Because these types of diabetes are rare, they are often misdiagnosed as other types of diabetes. You can learn more about these types of diabetes in the Classification and Diagnosis of Diabetes section in the Standards of Medical Care in Diabetes. If you think you might have one of these types, be sure to talk with your doctor. Understanding prediabetes. When it comes to prediabetes, there are no clear symptoms, so you may have it and not know it. Here's why that's important. Before people develop type 2 diabetes, they almost always have prediabetes blood sugar levels that are higher than normal but not yet high enough to be diagnosed as diabetes. You may have some of the symptoms of diabetes or even some of the complications. Regardless, check with your doctor and get tested. If you discover that you do have prediabetes, remember that it doesn't mean you'll develop type 2, particularly if you follow a treatment plan and a diet and exercise routine. Even small changes can have a huge impact on managing this disease or preventing it altogether, so get to a doctor today and get tested. Loved ones. Hearing that your child or loved one has diabetes can be a shock. But after that shock wears off, know that there are plenty of things you can do to help manage this illness. With planning and preparation, you can get back to normal life and resume your daily activities. You can make physical activity part of every day. You can create a balanced diet for your child, one that everyone can live with and thrive on. Throughout it all, know that diabetes can't keep your child from doing whatever they want and achieve their highest goals. There are Olympic athletes with diabetes, as well as professional football players, politicians, actors, rock stars and CEOs. So, take a deep breath. You can do so much to make sure the people you love are thriving as they manage their diabetes. Our Safe at School campaign ensures that the diabetes management needs of students are met so your children are healthy and safe when they are at school. By working as a team, families, health care providers and school staff work to monitor blood sugar and administer insulin. In addition to that, we can help ensure that all students have trained staff on hand who can recognize and treat high and low blood sugar and administer emergency glucagon. If you suffer from diabetics and want to live a normal life, click the link in the description for your free guide.